And that can be their condo, it could be a senior living, independent living community, it could even be in assisted living or some sort of other structured environment. So it's whatever version of home the client is living in.
Okay, and I know that you serve seniors and their other adults living in Lake and Cook, McHenry, DuPage, Kane, and Will counties, and even the Rockford area.
That's right. We do all 8 counties of northeastern Illinois, and we have about 100 social workers that are usually within 20 minutes of the client's home.
What a great service.
And so, everyone is so cost conscious. I guess we really need to know, is a doctor's referral order required, and is there a restriction on the number of sessions?
So a couple of thoughts on it is you don't actually need a doctor's referral, so you can call our number directly and make a referral for yourself, or it can be if we have adult sons or daughters who take care of their senior mom or dad, they can also call in and put in a referral. We do get many referrals directly from the physicians themselves, but it's not required on that. In terms of cost, most seniors who have Medicare covers this and is pretty generous with it. So there's usually, if you have a Medicare supplement plan, there's often no copay. And if you, but if there is a copay, it's usually a minor one with that. And then the number of sessions, and this is wonderful given that many insurances have capped how many sessions you can have, but Medicare is allowing 52 sessions a year.
Wow.
So we do have people that we can provide counseling for the entire year.
That's fantastic.
In addition to that, we can do family sessions, or in a crisis, we can do additional. So we could see someone twice or even 3 times in a week if there was a crisis occurring.
And then do you have bereavement too?
Yes. So I would say, and it's we do bereavement counseling, and that's frequently the reason for the referral. But there's often depression and anxiety that's also parallel to it.
Sure.
So in other words, even if there hadn't been the loss of the husband or the wife, that there, if you will, seniors have actually the highest rate of depression in the community, and that usually has to do with it's sort of, we think of it as the wisdom years, and that's true. But it's also a time of multiple losses that are inevitable or predictable. And often seniors have downsized from their home that they raised their kids, or they've lost their spouse. And even though we know that's going to happen, it doesn't mean that the person doesn't still not only get brokenhearted when it happens, but it's often, it lingers. And so we often have people, it's been 2 or 3 years, and they're still brokenhearted.
Sure.
Well, then that's turned into a more complicated story where they're depressed and aren't able to pull out of it. So we do the bereavement, if you will, short term. That might be just a few months. But we actually, with about half or more of our clients, it turns into long-term therapy, only because, and I'll give you a typical, as clinical director, I read the notes, the client charts. And so frequently I read, it isn't just the loss, and it usually is women live longer, they tend to have married younger, that they were younger than their husbands for this generation, people in their 60s, 70s, and 80s. And what I'll read is, it isn't just the loss of their husband. Their sister or brother has died as well. Friends have died. And so they have multiple losses, and that over a period of maybe 2 or 3 years, and that they've gotten really blue from that they've really gotten very sad from not just the loss of their spouse, but also their support network as well.
Eric, you just did a great job in covering a lot about some of the common bereavement situations that people need help on, and I'd like to call out to our audience. Eric's services are available. Use them. You just heard Medicare pays for 52, correct?
Yeah.
Right,
yeah,
or more sessions.
Oh, 52 or more sessions. Take the help that's out here. I ran into a gentleman this weekend that was in a state of depression, not from bereavement, but, well, it kind of was. It was bereavement of his independence.
Yeah.
And him and his wife, as you described before, they just downsized. They moved from their home, their beautiful home in Arizona, and moved back here into the Chicago area, which would depress me anyway, moving from Arizona. This gentleman had tears in his eyes because he says, I now need to rely on my children. And that has got to be, I don't think people consider that. That's also a loss.
Right. And because, so our main goal with the seniors is to get them back to a sense of balance, that they are both experiencing the highest quality of life that they can right now, but they also have peace of mind. And that's sort of our goal, if we can help seniors get back to that place, because things like the upheaval of a move, and I'll use an example that it's understandable why it is so upsetting and why for some seniors they experience it as catastrophic, is taking the adult children taking the car keys away from mom or dad.
Oh, sure. Yeah.
That is a huge issue and far more common. And as you can guess, this adult son or daughter have noticed that mom or dad really shouldn't be out on the road.
Sure.
Not because they're a terrible driver, but they're slow to react, or they drove like with my dad, he drove off the road accidentally, and he just got into the ditch, but we negotiated with him to give up the car. Because we just felt terrible if something happened to him or somebody else on the line, on the street. But it's a huge issue to lose that, because having to rely on other people for rides or call and we do have seniors use Uber and stuff like that, but that's still much more complicated, if you will, than having your own car that you just go out and zip off to where you want to go.
Right. And so I know that, a lot of people might say that they're feeling blue and they want to be more hopeful. Is that something that, the counseling services can help? Coping with?
Absolutely. Is that there's this Eric Erickson was one of the had a theory of psychology. He was a psychodynamic psychologist and writer, and he talked about that the theme for being a senior is integrity versus despair, and that it is, while we wouldn't say seniors just spend all their time, mostly they're in the moment, worrying about whatever or thinking about whatever's happening in the day. But there is also some reflection on what their life was about, and a part of do they have some contentment or a sense of satisfaction, and this is where the hope comes in. So, because the reality is seniors know their time is limited. They might think 10 years, they might even think 20 years, but they know it's tangible. You can see it on the horizon. And so hope gets a little tougher under those circumstances, because we're used to other phases of our life of that we're going to, get a promotion, or that our kids are going to graduate college, or you're going to walk down the aisle with your daughter at her wedding, that there's all sorts of wonderful things to look forward to. Well, as a senior, you've crossed many of those bridges.
Sure.
And now you're a senior who can see on the horizon, time is limited. And if you're distracted by the chronic pain from arthritis, or coping with multiple medical issues, or your kids your daughter moved to California and your son is in London, and they're not even around, and you don't even see the grandchildren that often. Mm-hmm. You really have to work hard to redefine what gives you hope, what gives you not just peace of mind, and kind of, we're not trying to have seniors be kind of zoned out and not experience their feelings, but creating hope is a conscious activity. and sometimes with the help of a counselor. That's the amazing things about talk therapy. As humans, we're very social. We love to talk to each other. That is actually is actually healing for people, that they can talk about both, come to terms, that integrity versus despair, that they can come to terms with that their husband is gone, but it was a good marriage, and that they had good kids, and that they were happy together all those decades. And we'll even have people reflect on if they can get past some of the grief, is to sort of sustain themselves. So it's like hope becomes fed with, partly the hope is reflecting on that you've achieved your goals, but you're also still able to have peace of mind even as a senior and cope with the multiple challenges of being a senior.
Eric, I'm going to ask you kind of a three-part question here. What about memory issues and cognitive impairment? What's normal? And what if I get Alzheimer's disease and dementia and I'm in the early stages, and maybe I see memory care being a need in the future? How do we deal with that as a person?
So, absolutely, and the reality is, and I love this from a physician who specializes in Alzheimer's, and he was doing this to an audience of social workers, and we were all a little bit old. We were all had been on the path for a while, and other counselors, and he said, we're all going to get dementia if you live long enough. And what he meant by that is not, however, in other words, cognitive impairment, slight, mild cognitive impairment is normal, because we all lose between 10 and 15% of our brain functionality, if you will. And that's normal. And our brain is literally atrophies slightly with age. And that's been since the beginning of time, and our ancestors had the same experience. But it doesn't mean that it could be, in fact, invisible. That I always point out, the Supreme Court usually is always really old guys and gals. They're old. But we trust the depth of their wisdom. They don't just, yes, all of them have, as would be normal, there's some cognitive impairment. But it can be very mild, and it's very normal. And it may be just you struggle to remember the name of a colleague, or you forgot where you put the keys. Some of that is very normal. So I want to normalize, and that's for the vast majority of seniors. They're not going to get Alzheimer's. They're not going to get dementia, or it literally wouldn't show up until you're after 100 years old or something like that. You would see that that's common for that age.
That's happening at 62.
But 62, most of this would not even have happened by 60.
When I go to the fridge and open the door and forget what I wanted to get.
Right.
That's normal.
That's normal, and in reality, the research is that was happening when you were in your 20s. You just don't remember that. Your brain just filtered that out. That there were times
because he drank a lot more in his 20s.
Yeah. I had a reason for that. I was drinking a lot in those days. So.
Right. So we don't always, and it's understandable only because many of the seniors do have a friend or a family member that has, and we had it in our family where someone had severe dementia and Alzheimer's, but lived well into their 90s. And yes, it was startlingly upsetting to witness that person fade in their functionality. So if you have an awareness, certainly you'd wait for a doctor to diagnose it, and you would have in part what's called a neuropsych exam. So there would be very specific testing to establish if you thought that you were having memory impairment. And indeed, there is a phenomena where the person knows that they have memory impairment, but they haven't told their doctor and they haven't told their family. Mm-hmm. So that's like the first phase of it. And then for some people, there is unfortunately a rapid acceleration. And we do work with people if they have a diagnosis of early Alzheimer's, and Alzheimer's is one of under the umbrella of dementia. Not all memory impairment is Alzheimer's. But if they are diagnosed with that, we do work with people, and we work with their spouse. So we provide counseling for the person who's aware that they're losing functionality, and it has its own, obviously, grief connected with it. Because it's one thing to lose your house or your car and have to downsize or not drive anymore. It's another thing to know that you're losing your ability to function, that your mind is going. And that does happen for folks, and understandably, they would want counseling during that period. Understandably as well, their spouse is totally stressed out because, and it's again, usually it's the wife that's younger, and she's caring for her husband who's now less and less functional, and she is the primary caregiver, and it is also heartbreaking to watch someone you love lose functionality. Mm-hmm. So all of that, you can see how both counseling for the wife is necessary, and we do that. Sometimes we do it as family therapy with the person with memory issues as part of the counseling. Sometimes it's just the wife has her own individual counseling. So we do that as well, so that sometimes we have both the husband with a counselor and the wife with a counselor each getting counseling. Because, and obviously it depends on how stressful the situation is. And as you can imagine, right now memory care is a huge issue. Lots of facilities are creating memory care units. Obviously, one of the big thresholds that's very upsetting is when you have to put your husband or wife into a memory care program. And so literally you're packing a suitcase for them and taking them over. And that's understandably very upsetting for people to do.
Mm-hmm. Eric, what advice do you have for folks who maybe are becoming discouraged because they have multiple chronic conditions like arthritis or diabetes, and they're suffering with pain and the impairment that causes, and they know that it's not going to get better, but just progressively worse, perhaps?
That is, and I always tell when I supervised young social workers, I would always say, ask with seniors, ask how it's important to ask how they're feeling, and ask them how they're feeling today. And then if they say, my knees hurt, don't just go past that, because in fact that is part of the thing with aging. Is lots of people have chronic pain that's always there. So some thoughts on it is, one is, if you do have chronic pain, or you have a loved one that does, first understand that means they may be irritable, or they may be depressed, or they may be distracted, or even a little out of it if they're overusing pain medications. So it's important that if there is pain, some of the doctors have said, don't wait to tell me that you're in pain. Tell me what hurts. And the very first thing is to work with your doctor with a good pain management program. Now, the issue a lot of seniors, I remember a senior that I would counsel with, he wouldn't take his meds that morning because he said they always made him foggy, and he wanted to be completely sharp for the counseling. But he was in pain the whole session. So there is, unfortunately, there's a little bit of a devil's bargain. If you take too much pain medication, or if you take a lot of pain medication, you will alleviate the pain, but you may be very foggy, depending on the meds. But the first is to work it out with the doctor to make sure you're following the correct, whatever the ideal pain management would be. So they're very familiar with it, but also sometimes it is, and this is one of the toughest things, and I will absolutely say that, is when someone has pain, they don't want to over-medicate and be out of it, but it's like having a terrible headache all the time. Of course we get irritable. Of course we get distracted. It's hard to be present for other people at the dinner table when we don't feel good. So, and again, counseling is one of the ways. We can't necessarily make the pain go away, but we can help the person come up with coping strategies.
Eric, do you see much, we've heard a lot about opiate addiction of late. Do you see much of that in the senior population, or concerns about that?
Not as, with our group, not like an epidemic of it. What we're usually seeing is we have some concerns about they might be seeing two different doctors, and so they're getting pain medication from two different people. Usually they have systems in place to prevent that, especially with the opiates or narcotics. But with other stuff, that sometimes can be part of the story. What we have seen, so yes, actually addiction still occurs. Normally, even with seniors, alcohol is still going to be the number one.
Sure.
In terms of common, that affects folks and that they have easy access to. So there are folks that have very complicated medication and pain management, and sometimes we have some concerns about dependency. What we do, and actually we do this for all of our clients, is we ask that they sign a release so that we can talk to their primary doc. And if they don't want us talking to their doc, that's fine. It's not to get all their medical records. But we do like to consult with the doctors, and if they have a psychiatrist as well involved, we'd like to have good communication so we're all on the same page. So we know what the doctor intends with their pain medication and what ideally would work out best for them. But an interesting phenomena that's happening is we work with seniors that are using medical marijuana. And that is surprising how many seniors have turned to that. And what I always tell seniors is actually it's perfectly legal in Illinois. Your doc does not give the prescription. They can only recommend a place where you can get the prescription. But if you go to any of the marijuana dispensaries, they will educate you. You can go to an educational program. There's also counselors you can talk to. And it's actually far more, we did a training at one of the dispensaries. It's far more elaborate and far more medicinal, and I want to say legitimate is maybe not the right word, but it is legitimate, but it is much more clinical. And they often have nurses, they have trained, licensed staff at the dispensaries, medical staff. So I would encourage that to learn about that, because that also can be both part of pain management. So seniors with cancer are often using medical marijuana as a way of dealing with that. So I would toss in there that there are legal and appropriate ways of managing pain that also don't have the same terrible consequences as the opiate addiction.
Those baby boomers.
Boy, I'll tell you. We were trailblazers.
That's right. That's keep on trucking, right?
That's right. That's right. It is amazing. For example, it's impossible to overdose on marijuana.
I don't know. I know a couple people who tried.
Well, Eric, the time flies when we're sharing information like this that's so valuable to our listeners. So can we take a minute and if you'll share your contact information, because we wouldn't want to run out of time and not have that out in the airwaves.
Yeah. So we are called In-Home Counseling for Seniors. And as we said, we do the Elgin area. We do all of northeastern Illinois. You can call us at 847-903-5604 and just press number 1 on the switchboard, and that'll get you. You can either leave a message. If it's after hours or during the day, you'll have an operator who takes the information, and then we'll have a counselor call you and set up an appointment. And again, that number is 847-903-5604. You can also call that number to get information about our services, see if your insurances cover it, or if there is a copay, how much it is. You can also go to our website at inhomecounselingforseniors.com, and we have all the information on our website as well.
Great, and it's covered, much of it's covered by Medicare, supplemental, and private insurance.
Especially if you have a
some
supplement.
Some
most
Medicaid
of those
even.
folks don't even have a copay, right?
Right.
Or if they have a Medicare, Medicaid partner, or they have both, those are it's usually covered as well.
Yeah, so it really eliminates a boundary. If you're suffering or dealing with depression or anxiety or grief and loss, we have a lot of families that are dealing with caregiver stress, as well as the illness or disability, and it's good for emotional support too. We were
Right.
talking
And
about the wives or the spouses.
Yeah, and you don't actually have to be a senior to get our services. You can be in your 20s or 30s and be disabled, or you could be that adult child who's stressed out, who's in their 40s or 50s. So our seniors don't have to be homebound. They could be mobile, doesn't matter. And we actually serve all ages with disabilities, or just they want counseling in their home rather than going to a neighborhood clinic.
And that's really important too, especially if they're in a crisis situation, because a lot of times the behavioral health centers have a waiting list.
Mm-hmm.
Right. We're able to see very quickly.
Yeah, so that's always important to know.
Well, just to let you know, I have I'm going to be giving you a call because I have we have a couple people that we've talked to recently that could definitely use a service.
Yeah.
Oh, absolutely. Wonderful.
All right.
We'd be happy to help.
All right. Well, thanks again, Eric. It was so good to have you on the show.
Eric, thanks. And thanks for what you do.
Oh, thank you. And thank you as well for getting the word out.
Okay. Bye-bye.
Thanks.
All right. Bye.
Remember, right care from right at home means your loved one is being cared for by the right people, doing the right things the right ways for the right reasons. Make the right choice today. Call Right at Home at 877-ELDER99. That's 847-343-3799.
All right, so we've got another minute.
Well, I was just going to say, Eric was a great guest because the counseling is. I think everybody needs some sort of counseling, somebody else that gives another perspective, or just somebody to talk to.
Well, and then it takes away the barrier about going to a facility or anything like that, and so there's no reason that somebody shouldn't get counseling.
Mm-hmm.
Especially if you can have it private in your home. It helps so much.
Amen. So we'll see you next week on Silver Solutions Radio.
This is Tori from the Radio Shopping Show, inviting you to live large for less every day, right here on the Voice of the Valley, 1410 WRMN Elgin and WRMN.
An Aurora man faces child porn charges after Google alerted police.